number of HIV and AIDS cases in the Commonwealth of Virginia is up substantially. The first half of 2008, there were 400 reported cases of HIV in the Commonwealth. The first half of this year, there were 691 HIV cases. For AIDS, in the first half of 2008, there were 281 cases in Virginia. In the first half of this year, new AIDS cases shot up to 461. Joining us now to discuss the increase in HIV and AIDS in Virginia is Dr. Gregory Townsend of the UVA Ryan White Clinic, which is a specialty clinic for the care of those with HIV and AIDS. Thanks for joining us.
Glad to be here.
Now, first of all, any ideas on why this dramatic increase in Virginia?
I certainly could speculate on a lot of things. One of the things you need to ask yourself is, are we actually seeing an increased number of cases, or are we just diagnosing more of the cases that are out there? It may be that we're diagnosing more because people are testing more, which is one of the CDC recommendations, is that we start testing more people with HIV. But it's also possible that there are more infections going on than there had been in the past.
Is there a possibility that there might be more complacency in the United States, because we've heard, I think you would agree, more about HIV now can be treated and maybe isn't the death sentence that HIV and AIDS used to be?
Absolutely. I see patients in the clinic pretty regularly who tell me that they simply weren't as careful about safer sex practices as they might have been in the past, or as the population as a whole would have been in the past, because they've heard, as you said, HIV isn't the killer that it used to be, the medicines aren't as bad, it's not a big deal, why do I need to worry about it? And people are taking chances that they weren't taking before.
Does it also maybe have something to do with the age group? I guess when you say maybe 15, 20 years ago, AIDS was really in the news and really as a death sentence,
right.
And maybe some of the younger kids now haven't heard about that because they weren't really around when that was going on.
Absolutely. 15, 20 years ago, almost everybody who would have been in the major risk groups for HIV, men who have sex with men or injection drug users, they would have known somebody who had died of AIDS, and at least that would have put the fear of God into them. And now you can be in one of those major risk groups, or not in a recognized risk group at all, and not know anybody who has died of AIDS, or know people with HIV who are doing fine. And again, you think, I don't need to worry about it.
Now, tell us about the protocol for someone. Now, everybody from the Central Shenandoah Valley who is diagnosed with HIV, which is the precursor to AIDS, is sent to your clinic. What is the protocol when someone is diagnosed with HIV now?
Okay. Actually, just a minor correction. There are actually a couple of clinics in the central and western Virginia area now. There's actually a clinic in the Harrisonburg area where they're providing great care. So we're not the only place.
Okay.
But we do get a lot of patients here. And generally speaking, we'll first find out how the patient is doing in the general health, and then more specifically how they're doing as far as HIV goes. And what we're most interested in is whether or not their immune system has been damaged. And if it has been significantly damaged by the virus, we can measure that by doing a simple blood test, then they would be offered medications for HIV.
All right. And what is the survivability nowadays when someone is diagnosed with HIV?
We think it's really good. We don't have any firm numbers just because the medicines that are so effective for treating HIV have only been around for less than 15 years now. So we don't know for sure, but our approach in the HIV clinic is to let people know, and this is our belief, that if they take their medicines properly, and they do all the rest of the things that they should do to stay healthy, that there's no reason to think that someone who was diagnosed with HIV in the 2000s shouldn't live to be 85, 90 years old like the rest of us.
Really?
Yes, absolutely.
So a much better prognosis.
Much better outlook than it was 20 years ago.
Okay, very good. Well, Dr. Gregory Townsend of the UVA Ryan White Clinic, I want to thank you so much for joining us.
Glad to be here. All right, take care.
Take care. And now let's send it back to Kay.